Welcome to Inspirational Women in Biotech and Medicine. I am Sadie Senator, and today I have with me an amazing guest, Dr. Kimberly Garfinkel. Dr. Garfinkel is a mother of four and is an obstetrician and gynecologist. She is currently a practicing physician with a focus on women's health. Dr. Garfinkel, thank you so much for joining us today. I'm so excited to hear and share your story.
Absolutely. I would say if I'm going to take it all the way back, I think in high school, I developed a real interest for science, biology, medicine. And I just, for some reason, had an inkling back then that that's kind of what I wanted to do when I went to college. So when I went to college, I knew I was pre-med. So I did all the things that one does. And I ended up going to UC San Francisco for medical school, which was fantastic. I knew that I had a pretty significant interest in women's health uh, since college. And so I was gearing toward OBGYN during med school. I also loved emergency medicine. I also loved I loved everything. I really did. But women's health, I kept coming back to, even though I would go do rotations and lots of different things. I just kind of kept coming back. And then I took a year and did a master's in public health at Berkeley because I also wanted to know a little bit more about international medicine and women's and children's health internationally. And then I did my residency for 4 years in OBGYN. And then I became a general OBGYN practitioner through Kaiser Permanente, which I've worked on and off for a long time, since 2002. And what else can I say? And now I have over time sort of switched my interest. And now most recently, I'm primarily working in women's health, menopause, sexual health, aging, obesity, and those areas.
Okay, thank you so much. That's an amazing journey and quite a few paths that you've taken. So, just to start, can you tell us about how your academic background, so your work at UCSB, UC Berkeley, UC San Francisco, how that has affected or comes in handy in each of your roles that you've had to do?
So interestingly, my major in undergrad was microbiology with an emphasis in genetic engineering. And I at the time, this is a few years ago, I graduated from undergrad in 1995. So you can understand the vintage. But at the time, DNA technology was just kind of in its infancy. So PCR machines, we got one at my college, and those kinds of things were just coming online. And the idea of genetic engineering was super cool and super interesting. I kind of, in the back of my mind, thought if I don't end up going into medicine, I could do something in biotech because that was really big. And so that's what my major was in. And I found through that process, one, that was really, really interesting, but also that doing basic science in a lab was not a strength for me. I mean, I really loved the content, but sort of the pipetting and the details and those things, it just didn't bring me as much joy as I thought it might. But it was really interesting, and I've always, I've really loved having that knowledge. Um, and then so academically, throughout undergrad, I spent a lot of time doing all the things that a lot of pre-med students do. I spent a great deal of time teaching, which I absolutely love, and that would be my alter ego profession. And so I worked for the organic chemistry department at my school and did a lot of tutoring for them and for biology. I even did it after college. And then in med school, I also taught groups of students in the lower ages in anatomy. I did a lot of anatomy tutoring and teaching. So that was kind of a through line throughout is teaching. And yeah, and then I kind of did a lot of volunteering, when I was an undergrad at a hospital, like a lot of folks do. And I did a ton of community service. I did student government at my undergrad, and it was involved in chairing the community service element of school, which again, spent doing a lot of healthcare and children's and women's care. And that's kind of it. I don't know if I answered the whole question.
No, that's lovely. And how do those studies impact the work that you're currently doing, specifically the work with women's health and sexual health and all of that you were speaking about?
Well, I think that it definitely helped me hone in my interest in women's health even more. A lot of the kind of volunteering I did also was with sort of STD clinics and things like that. So I think that's always been sort of a focus of mine too, and women's prevention. And also abortion rights has always been a part. I've always been involved with groups that have to deal with promoting women's choice. And when I was in resident or in medical school and residency, I had the opportunity to work at the Women's Choice Clinic, which is at San Francisco General Hospital, which does the foremost training in abortion care in the country. You know, medical students from all over the country come in to get trained. And so that was an interesting experience to have as part of my training. And it's not what practice now, but I really value that I had that experience. And it's very much a part of my my belief system is supporting women's choice.
Okay, definitely. That makes a lot of sense. And what does your typical workday look like as of now, and how has that changed and evolved over the many different roles that you've had during your career?
Right. So, and careers, like specifically going back to my actual career roles, after residency, I immediately worked for Kaiser Permanente as a full-time generalist. And what that meant was I would see clinic patients every day. And certain days of the week, I would be in the operating room doing surgeries. And then a couple times a week, I would stay overnight in the hospital and do labor and delivery call and deliver babies and do C-sections. And that was super fun and crazy and great and busy. But it was like, 60-hour work weeks and not spending a lot of time at home. And so I did that for several years and realized as my family was starting to grow, I got married and had one kid, then that turned into two, and then it turned into four, that it wasn't really sustainable for me to work sort of that way. And so I bumped it back to sort of more of a part-time role. And I did take time off. I took time off after my second child was born, I took a break from my career and worked on being a parent and supporting my husband, my spouse, who travels all the time for work. And I just really wanted to be home for my kids. That's kind of how I was raised, and it was really important to me. And I really, really valued that time. And I stayed home for a couple years while my third and fourth child were born, close together. And then I slowly went back to work, which was nice. I have to admit, I was nervous after spending a couple years off. But I went back to clinic only work. I never returned to the operating room or labor and delivery. And that was pretty much by choice, mostly because I wanted to be flexible, to be home with my family. And I missed it to some degree, but did not miss the stress and the chaos to my schedule, if you know what I mean. And so I went back to work part-time in the clinic back at Kaiser, and it was phenomenal. I love it so much. And it also kind of incorporates my love for teaching too, because every time I see a patient, I'm talking to them about how to take care of themselves and answering their questions. So my regular clinic day, long story short, is I go in and do mostly well women visits with women who come to the clinic, mostly GYN, although I do some prenatal care visits. And a lot of it has to do with basic women's health screening, whether that's pap smears, mammograms and breast health, colon cancer health. And then I do a significant amount of counseling in health and wellness. I screen for domestic violence, for mental health issues, and I do a lot of discussion about diet, exercise, well-being, sexual health, relationships with their partners. And then now that I'm seeing more and more patients that are my age and older, sort of in the perimenopause stage of life, I'm doing a lot more menopause counseling, hormone replacement therapy counseling, and just general wellness about age and how to age well and help, in a healthy way. And so that's my basic day is being in the clinic all day long, seeing patients, and I really, really love it.
Oh, that's amazing. And what did the transition look like for you from going and taking your break of not working to going back into the clinic? Was it manageable? Were there any barriers that you faced, or how did that feel for you?
So it's so funny that you asked that because I've talked to a lot of my friends and we've always been talking about how, professional organizations should really have like a track for women or for people, anybody who wants to take a break from clinical practice and re-enter. I think for me, it was really I had to figure it out myself. And the good news is I had a really good relationship with my colleagues at Kaiser. And so I was able to reach out to them and say, "Hey, I've been out for a little bit. I'd love to come back and work." And they had this great process to sort of reproctor me, which didn't require a ton. I kept up my board certification. I did all my board certification, continuing medical education units that I needed to do regularly. So I did all of that. And so I didn't feel like my knowledge base had really fallen off. It was just more being in the clinic and the technical aspects of patient care. And so I was able to get mentors uh, at Kaiser to sort of get me back up and running, which was amazing. And and then I was able to feel comfortable pretty quickly. Like I think more quickly than I thought. I think I had some anxiety leading up to it, but once I was there, um, it kind of was like riding a bike, if you know what I mean. I mean, when you're in residency and med school, you spend so many hours training, so many hours that it definitely just becomes a part of your soul, what you're doing. And so it came back relatively quickly, but um it took me to sort of sort it out. So I think for women, and it could be different now, it kind of depends where you work and who you work with, but you kind of have to go on your own and say, okay, how am I going to do this? You have to go and knock on doors and figure out how you can get back in the system. I was also able to find out that if I wanted to be reproctored to do labor and delivery, I could do that. I decided against it at this point. It's something I could always do. If I woke up one morning and said, oh, I really have to deliver babies again, I certainly could probably go back through that reproctoring process and work with other physicians and do that. Um, but I'm really happy with how it worked out and my flexibility now. I work part-time and I can choose my clinic days, which is amazing. Month to month, I can decide what days I want to work, what days I don't want to work, which works well for my family. I think I'm very, very lucky because a lot of physicians don't have that luxury of having such a flexible schedule. But fortunately, it's worked out pretty well for me.
Okay, I'm really glad. And something that I've been noticing among all of the interviews is the importance of having that mentor. So hearing that the mentor is really important in making that transition back sounds super important. And I'm glad to hear that you had that. And kind of on a similar note, how do you manage your work-life balance? And what are some aspirations that you have outside of work that have become super important to you as you've had the more flexible schedule and more time outside of work?
I think that one of the main things sort of I came across in sort of this frantic, desperate quest to have balance is understanding it's never going to be perfect. You know, you're, and even if I didn't work, I would always feel like I couldn't be the perfect mom I wanted to be because being a mom is hard. I think anyone you're talking to has extraordinary expectations of themselves. So I think acknowledging that it's not going to be perfect to do both, acknowledging that, I probably wasn't going to reach the pinnacle of my career if I also wanted to spend a lot of time at home, whatever the pinnacle is, whether it was publishing a lot of articles or being on faculty at a academic institution or any number of those things. So I kind of decided to be one with those things and just focus on the things that I could control and that made me happy and focus on having a happy, healthy family and being healthy myself and sort of making that a priority. Um, but every once in a while it's a stinger to know that there's some things, could I have done a fellowship? Maybe, things that I could have done that I didn't do. But I always revert back to my family and how grateful I am to have the family that I have. And I would not change anything. Absolutely would not change anything.
That's amazing to hear. And
Mhm.
then what has been some of the most rewarding parts of your career? So far.
I would just say, working with women, delivering babies obviously is it's like as good as it gets. Like to being the first person to touch a new human being that comes into the planet is pretty spectacular. But just working with women in general and hearing their stories, I think that a lot of women aren't used to their doctors asking them questions that are pretty intimate and personal because there's a lot of doctors who don't feel comfortable asking those questions or don't take the time. And so I feel like it's a real privilege that I get to have that time with patients and they feel comfortable talking to me about the intimate parts of their lives. And that's just been very, very rewarding. And, I want to be a good role model for my kids about working and having a family and finding balance, which is also very important to me.
Okay, definitely, that makes sense. And do you have any specific stories that you've had with patients or experiences that you've had that really stick with you and kind of motivate you in everything that you do?
Let's see. There's there's probably a ton. I will say there was a time when I had recently just returned to work and still having a little bit of sort of trepidation, do I remember enough? Am I ready for this? And a woman came in my clinic who was describing some symptoms that she was having that could have very easily been chalked up to just a regular menstrual period, to be honest. But she was feeling ill and she had lost weight. And there was just some minor things that she said that made me nervous. And we don't usually send somebody to the lab for having one slightly heavy period. That's not something that we usually get in a panic about. But there was something about her particular situation that gave me concern. And so she went down, and it turned out she was in a fulminant leukemia crisis. And she was immediately admitted to the hospital and had a bone marrow biopsy that day. And it was one of those moments where I thought, had had I been in a rush, I would have just been like, oh, she's probably fine. If it gets worse, she'll call us or whatever. But for some reason in my head, there was something off about her presentation. And it made me realize that, I still had instincts and I didn't forget everything, but also how important it is as a physician to always be thinking and always be listening to your instincts and never discounting what a patient says. Because sometimes a patient will say, I know how I'm supposed to feel and this isn't it. And even if it's something that seems benign to me, I feel like every time I've listened to a patient who says that, when they say, I know my body and this isn't normal, even if I don't find a problem, every time I listen to them, they are right. And there is something that needs to be followed up on or an ultrasound that needs to be done. So I've realized that listening to people when listening to patients is the most important, valuable thing I can do.
Wow, okay, that is an amazing story. And I guess the idea of intuition, both about your own body when you're presenting yourself to physicians, and also,
Mhm.
I guess, the physician intuition is
Mhm.
important. And
Mhm.
kind of on the opposite end of that, what has been a challenge that you faced, maybe other than, transitioning back to work after a break while trying to be a physician and succeeding in your field as a woman?
You know, um, I mean, there's certainly a lot of challenging medical cases. There's, people that get sick and have bad outcomes that you don't anticipate and that aren't, and easy to anticipate. Um, there are times where there are many times back in my early training of med school and residency, and even beyond, where when I would walk in a room, even in a white coat, somebody would say to me, "Hey, nurse, when is the doctor coming?"
Okay.
And so that was an interesting challenge. Sort of, I'm really hoping that doesn't happen as much anymore, but I was surprised that even in my time, that was still happening quite a bit. So those are things that are difficult. You need to prove yourself and, and come up against boundaries. I think women are going to have some of these obstacles in science and medicine still to this day. And you just have to push on through and defy some of the stereotypes and believe in yourself and get through it.
Wow, what would you say if someone were to say, "Oh," like, were to assume that you were a nurse or tell that
Mhm.
to you?
And
What
for
would
the
you
record, let me
respond?
just tell you that nurses are spectacular clinicians.
Yes.
And I will say this, I learned more about delivering babies from the labor and delivery nurses than I did from my staff at my hospital because they see them and I do it all day long and they're spectacular. So I have nothing but respect. And many times I wonder, maybe I should have gone into nursing. That's a different story. But so I don't want to in any way belittle nurses who are incredible human beings and clinicians. But I have no problem, correcting somebody and saying, actually, I'm your physician. How can I help you?
Yeah,
These days it rarely happens because our name tags in the hospital say real big what we are, doctor, nurse, maybe that's for that reason, I don't know. So it'd be really hard these days probably for that to happen, but I had no problem, asserting myself politely.
yeah, definitely. That makes sense.
And a lot of people, by the way, were
Yes.
horribly embarrassed.
Okay, that's good to know. And yes, of course, shout out to all the nurses. I
Yes.
completely see all the work they do. And just a last question for you is what advice do you have for young women who are interested in the field of medicine and are trying to choose a path and a career to follow?
You have said it. And uh, I think that finding a mentor is so important. And I wish I had learned that much earlier. And it doesn't just have to be one. And it doesn't have to be one that is somebody that you're best friends with or that you think you super duper know real well. If there's a person, whether it's in middle school, high school, college, that you're interested in or you think has similar interests to you can reach out to that person. You can just say, hey, I really think it's cool what you're doing. I'd like to know more about that. And those kinds of interactions are so incredibly valuable, and that will lead you to so many different opportunities. Um, and it's okay to have a few of those people in your life and collect them along the way. Uh, and you will get so much more exposure to different kinds of things. And that's even if it's not a mentor in a science field. I think that when I was going through school, I was in these huge classes. I went to a UC for undergrad, and there was 1,100 people in my biology class or something crazy. So getting to know the professor was intimidating, and it didn't occur to me that I could just go to his office hours and introduce myself and spend time with him. I was just too intimidated. I think now you guys are trained in school. You have a lot more experiences actually getting to know your teachers, which is spectacular. So I wish I had done more of that. I also wish I would have leaned into some of my interests and said, I really love women's health, but what I really, really love is sexual health, or what I really, really love is menopause. At the time, it didn't really exist as a special thing, but I bet I could have figured out how to do it earlier. Um, if I just like kind of pushed on and just kind of figured it out and found people who practice that way. And it didn't really occur to me. And it was also sort of an exhausting effort. And the internet wasn't really a thing. There's a lot of reasons why it was a little bit more challenging. But I would say if there's something you want to do, even if you can't really find an actual job that's that thing, then make that your thing, and find a way to make it happen. And it doesn't have to happen now. You said it before when we were talking before that you can always reinvent yourself. You can always have a next chapter. Right now, I'm doing training in both becoming certified as a menopause practitioner and as a practitioner in obesity and weight management and health. And I'm getting separate certifications for those things. And that's just something that's very interesting to me. And I'd like to know more about. So there's always time to learn more things. So don't ever stop being curious and wanting to learn more.
Okay, that is very inspiring, the part about leaning into your interests and making a role for yourself. That's gonna stick with me for a while, so I really appreciate that
Absolutely.
advice.
If there's something you think you want to do, just do it, for sure.
Definitely. Okay, thank you so much. That is really inspiring, just your whole story, and that you're continuously learning and trying to do new things that you just find interesting for yourself. That is very inspiring to me. And I really appreciate you taking the time to speak with all of us today and share your story and be so inspiring.